Dear Heavenly Father, thank you for your blessings. As we come together now, we just ask that your Spirit would be with us to guide us, direct us. I pray for a blessing on each one here. Lord, help us to understand this illness and how best to combat it. And I pray that you would just remove any distractions. In Jesus' name, amen. So again, we teach from the Bible inspiration, good scientific research. We want to know what we're doing is good, and we want to apply the principles that God has given us so we understand it better. I believe that our Creator intended for us to be in good health, and that is so that we can use that health to serve Him. We have precious truths to share with you that, when adhered to, they save lives. I believe God has a plan through which He can accomplish this in just a few of us. Is that what it says? No. God has a plan through which He can accomplish this in all of us. God's plan is available to everyone because God is an equal opportunity God. So God is not going to exclude somebody based on where you live or based on the amount of money you make, or based on the color of your skin or your gender or whatever it is. God's plan is inclusive, whereas the world's plan is exclusive. It excludes people. And God's plan is different than man's plan. So, I told you we have precious truths to share with you. But what exactly is truth? Let's read this quote together, shall we? Truth is not what I believe. Truth is fact. I may not believe it. I may not know it. That does not change it. It is there, nevertheless, waiting to be discovered and believed. Truth does not depend upon the unsettled and changing opinions of men. It was truth before it was believed. It will remain truth whether it is believed or not. Carlisle B. Haynes. I believe we're sharing with you God's truths, and you have the choice to believe them or not. We should educate ourselves not only to live in harmony with the laws of health, but to teach others the better way. So you being here tonight is good for you. You learn a few things that can be helpful for you, but guess what? I also want you to share some things with others as well, because that's important. Many, even of those who profess to believe the special truths for this time, are lamentably ignorant with regard to health and temperance. They need to be educated line upon line, precept upon precept. The subject must be kept fresh before them. This matter must not be passed over as non-essential. For nearly every family needs to be stirred up on the question. The conscience must be aroused to the duty of practicing the principles of true reform. God requires that His people shall be temperate in all things. Okay? Temperate in all things. Unless they practice true temperance, they cannot be susceptible to the sanctifying influence of the truth. So, I like that quote. I believe that health is spiritual, and spiritual things are spiritually discerned. A couple examples from the Bible. Numbers chapter 12 and Mark chapter 5. Let's talk about Numbers chapter 12. Numbers chapter 12 tells the story of Miriam. Miriam was Moses' sister, and she and her brother Aaron said, "Aren't we also prophets? Don't we also lead these people?" She was envious of Moses' position. And she said that, and immediately she was struck down with an illness. Does anybody remember what that illness was? Leprosy. And like we said this morning, leprosy was one of the worst diseases you could have in Bible times because it was an unclean disease. So it made you ceremonially unclean and anyone else around you ceremonially unclean. Miriam immediately realized she'd made a mistake. She asked God to forgive her. And also Moses prayed and asked God to forgive her. But she still had to wait a week before she was healed. So she had to go and live outside the camp by herself, and they didn't leave that area until Miriam was healed. She came down with a physical ailment because of a spiritual condition that she had in her heart. She was envious of Moses, her brother. So, I think health is spiritual, and spiritual things are spiritually discerned. That's why we spend time as we're teaching you and sharing with you on talking about spiritual things. Here's a promise in the Bible, Exodus chapter 15, verse 26. It says, God said, if thou wilt diligently hearken to the voice of the Lord thy God, and will do that which is right in his sight, and give ear to his commandments, and keep all his statutes, I'll put none of these diseases upon thee, which I have brought upon the Egyptians, for I am the Lord that healeth thee. Now, we know the Bible tells us the story of how the children of Israel left Egypt. And they left after these 10 plagues, and they went to, they started to leave, and the Egyptians gave them things to take with them when they were leaving. And after they had left for a period of time, the Egyptians were like, wait a second, we just got rid of all of our labor. We're going to have to do it ourselves now. And so they went chasing after them. And the Bible records that they followed them all the way into the Red Sea. And the Red Sea closed upon them, and they drowned. That Pharaoh died in the Red Sea. So that moment in time is recorded in Egyptian history. So we know when that happened. We also know that when the children of Israel left Egypt, there were certain diseases that the Egyptians were facing. The Egyptians were one of the most affluent societies in the world at that time. They also preserved their dead by making them into mummies. So we know the things that were killing the Egyptians at that time. And the top 3 killers in Egypt at that time were heart disease, cancer, stroke. Much like the things that kill us in our society today. Now, we're a lot like Egypt in the sense that we are an affluent society. We have some of the best medicine in the world. And yet we're dying from those same diseases. So what that tells me is that we haven't diligently hearkened to the voice of the Lord our God. We haven't done that which is right in his sight. We haven't given ear to his commandments, and we haven't kept his statutes, because we're facing the same diseases that the Egyptians faced thousands of years ago. Shame on us. And our definition of disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. And the 8 laws of health. We use the acronym NEWSTART to represent those 8 laws of health. So nutrition, exercise, water, sunlight, temperance, air, rest, trust in God. These 8 laws of health really do nothing by themselves. There's no magical power in those 8 laws of health. Okay? The power of God is working through those 8 laws, through these principles that God has given us. It's God's power that is working. So let me ask you this. Is anything too hard for God? No. So we should not doubt that God will do what he says he can do. If he says he's going to heal you, he can do that, and we should not doubt that. So talking about medications, drugs, people need to be taught that drugs do not cure disease. Working in the ER, I have patients who come in and I'll say to them, do you have any medical problems? And they say no. I say, okay. So I start looking through their records, and I notice, I notice you're taking this medicine for high blood pressure. And I'll ask them about that. And they say, well, yes, I am taking that blood pressure medicine, but I had blood pressure problems, but I don't have them anymore. The medicine fixed it. Oh, I noticed you're on a cholesterol medicine. Yeah, but I saw my doctor 2 months ago and he says my numbers are perfect. They're stellar. Or you have all these other diseases and you're on medicine, but they don't have any disease anymore because the medicine has solved the problem. I don't want you to fool yourself into thinking that medicines solve any problem, okay? They do not cure disease. Medications are a band-aid that treats the symptoms but does not affect the cause, okay? Don't forget that. God designed our bodies to heal and repair when we put them in the right condition. That's the key to fixing disease, is to put your bodies in the right condition. And God has blessed us with the ability to heal and repair. Again, talking about medications, patients appear to recover as a result of its use. This is because nature has sufficient vital force to expel the poison and to correct the conditions that cause the disease. Health is recovered in spite of the drug, not because of the drug. Okay? So our topic is diabetes. Well, what exactly is diabetes? Diabetes is an elevated fasting blood sugar. Fasting means we have gone for 8 to 12 hours without taking in any calories, either calories as solid or calories as liquid food. A blood sugar of 99 and below is considered normal. So this is the number that we use in this country to say what's normal for blood sugars. A fasting blood sugar of 99 below is considered normal. A blood sugar of 100 to 125 is considered pre-diabetic or borderline diabetic. And a blood sugar greater than 125 consistently is the definition of diabetes. So those are the numbers we're going to use as we talk about diabetes. We need to talk about the types of diabetes. Type 1, we used to call juvenile diabetes because it mainly affects juveniles, younger people. This is a minority of diabetics. Only about 5% of diabetics are type 1s. These people are thin. They are rarely overweight. They have had something affect the beta cells of their pancreas. And when that happens, their pancreas no longer makes insulin. So these patients need to be on insulin because the beta cells in the pancreas are where insulin is made, and they've been damaged either due to a viral infection, some form of a toxin like maybe a heavy metal or something like that, or an autoimmune reaction where the body actually attacks its own pancreas and damages it. So type 1 diabetics typically have to be on insulin. Infants fed cow's milk are at greater risk of developing type 1 diabetes. And we'll talk a little bit more about that in just a few minutes. Here's a website you can look at, notmilk.com. Notmilk.com. I encourage you to take a look at that when you get a chance. Type 2 diabetes, we used to call it adult onset because it mainly affects adults, mainly affects people who are at an older stage in their life. This is the majority of diabetics. More than 90% of diabetics are type 2 diabetics, okay? This generally hits around age 50 as people get older and bolder. As we get round is when our diabetes starts to come around, okay? When we start to gain weight, especially central weight around the core of the abdomen, is when we start to see type 2 diabetes. These people have plenty of insulin, but the insulin is not doing its job. It's not working. Hence, we have the term insulin resistance. They say half the diabetics in this country don't know that they have diabetes. Half the diabetics. There's a third type of diabetes. You don't hear very much about it. I'm going to call it type 1.5. Researchers at Children's Hospital of Pittsburgh, CHOP, found that 25% of their pediatric patients had symptoms of type 1 and type 2 at the same time. So that's a little more complicated. It's harder to treat. It requires a dual treatment. All right? So the classic hallmark warning signs of diabetes, these are the things that make you think, hey, this patient could have diabetes, are polydipsia, excessive thirst. Okay? That's often one that's seen very early if you're becoming a diabetic. Polyuria, excessive urination, increased urination. And polyphagia, increased appetite. Those are the classic hallmark warning signs of diabetes. But there are other warning signs, things like weight loss, all right, irritability, fatigue, and blurry vision. Those can be hallmarks of or warning signs for diabetes. So I have a question. Do you mind if I tell you a story? All right. And Tina knows this. Most of you responded. I appreciate that. If I ask you, do you mind if I tell you a story, I need you to respond to me. I need to make sure you're all awake and you're with me, okay? If you don't respond, I'll just keep going. And not all the stories, but some of them are pretty good, you know? Not all of them. So you never know which one. So I appreciate you responding, all right? So I was working in the ER one day, and this was a long time ago. This is when we still had paper charts. So yeah, it's a long time ago. And so I was working one day, and a young female came in, and they put her chart in the rack. So I went and picked up the chart. This young female was in her early 20s, and the chief complaint said urinary problems. So if I'm seeing a young female who has urinary problems, what am I worried about? What am I concerned about? Yeah, urinary tract infection, right? So I went and saw her, and I told her, you know, we want to make sure you don't have an infection. I took a history, did a physical exam. I said, we need to check your urine, and the nurses had already gotten a urine and sent it off to the lab when she came through triage. So I said, I'll be back when your urine comes back. Went about my business doing other things. Her urine came back, and she did not have an infection, okay? So I looked through the results, and I saw that she had sugar in her urine. So I went back to talk to her. I said, listen, you don't have an infection, but you have sugar in your urine. I think we need to check some lab work on you because you have sugar in your urine. She said, you're not checking my blood. I was like, oh, okay, what did I say? What did I do wrong? Like most people, she didn't like needles, and so she didn't want me to check her blood. Fortunately, her father was there, and between her father and myself, we convinced her that it was a good idea to do some lab work. So we did some lab work, and when it came back, her blood sugar was high. Now, I wasn't surprised, because if you have sugar in your urine, 99 times out of 100, your blood sugar is going to be high. What surprised me is how high her blood sugar was. Her blood sugar was almost 2,000. Yeah, highest blood sugar I've ever seen in my life, okay? So I went back and talked to her and told her, listen, this is dangerous. This is serious. And so we put her on insulin. We gave her IV fluids. We admitted her to the intensive care unit. She survived. She's very blessed that she survived. If she would have treated it like maybe some women might and said, you know, I may be getting a urinary tract infection. Let me wait for a day or two to see what happens. She probably would have died. So she got admitted, and then I saw her again about a period of time, maybe a couple of months after I saw her that time. She was doing a lot better now. I recognized her, but I didn't say anything. She also recognized me, and she apologized to me because I guess her father told her that she nearly bit my head off when I told her that she needed to get blood work. So she was in a different state of mind at this point, and I could talk to her a little bit about lifestyle and things she could do. But she had new onset diabetes, and her two symptoms were urinary complaints and irritability. That's it. That's all she had. She didn't have any of the other stuff, you know? So this stuff is real. I've seen it happen with my own eyes. That's what I want you to know. Diabetes affects all the organs of the body, and it gradually destroys them. It affects your arteries. It promotes atherosclerosis, which is hardening of the arteries. It doubles your risk of having an MI, which is a myocardial infarction, or a CVA, which is a cerebrovascular accident, a stroke. So it doubles your risk of having a heart attack or stroke. It doubles the risk of having a heart attack, and your risk of a stroke goes up 5 times. 5 times. It can lead to hearing impairment and sexual dysfunction if it affects the blood vessels that lead to your hearing apparatus or your sexual organs. In fact, let's just talk about this for a minute. I know there's just 1 or 2 young people in here, but what is ED? Now, I've got to tell you, I'm an emergency physician, all right? So to me, ED is the emergency department, right? But what is ED? Erectile dysfunction. Okay. And what causes it? Poor blood flow to your sexual organs, all right? So if you have atherosclerosis that's affecting your sexual organs, causing poor blood flow, where else do you have atherosclerosis? Everywhere else in your body. So if you take a pill, a workaround to get around this problem of ED, you may actually be doing more harm to yourself because you may be putting yourself in a position that your heart is not up to. So, don't think that a pill solves this problem. The way to solve it is to get at the root cause of the problem. Diabetes can also cause something we call intermittent claudication. Intermittent claudication is where you have like a intermittent blood clot. So they have atherosclerosis, especially affecting the large blood vessels in their legs. And people who have this will tell you, I can walk 2 blocks and I feel okay. But if I walk more than that, I get this really intense pain. And I have to go and sit down for a little bit and rest for 10 or 15 minutes. Then I can walk another 2 blocks again. Okay? So this intermittent claudication can really be limiting on your activity. Diabetics also can get gangrene. They bump their toe and don't realize it because they don't have good sensation. And then they don't care for it very well. And it gets infected because they have sweet blood. There's sugar in their blood, and bacteria love that. And by the time they notice it, these bacteria have overgrown and have started to take over. And they have an overwhelming infection that is not going to get better. And so they have to have the gangrene, the dead tissue, cut off. And so they may lose a toe, a piece of a foot, a part of a leg, all of these things that can be very detrimental and very devastating for diabetics. Diabetes also affects the eye, causing decreased vision. 8 out of 10 diabetics develop eye problems. Diabetes is the leading cause of new blindness in developing countries. Diabetes also affects the kidney, affecting its ability to filter blood. It makes one 18 times more likely to develop serious kidney damage. And up to 50% of dialysis patients are diabetics. That means half the patients in the dialysis center typically have diabetes, and the other half have hypertension. It affects your nerves, especially your peripheral nerves, causing tingling, pain, numbness, or weakness, especially in your extremities, in what we call a stocking, like from here down, glove, like from here out. Stocking glove distribution. It affects your distal extremities, causing numbness, tingling, pain, all these things. It also affects your autonomic nerves. Your autonomic nerves are your automatic nerves. So, for example, I have my water bottle. I'm going to take a drink of water. When I swallow that water, I can no longer control it. Okay? There are muscles in my esophagus, my swallowing tube that goes from my throat to my stomach, that contract and relax and contract and relax and move food and liquid down into my stomach. It happens automatically through what we call our autonomic or our automatic nervous system. I don't have to sit there and think, oh yeah, I just drank some water, I better swallow it and get it into my stomach. Our body does that automatically through that part of the brain that my wife was having a hard time pronouncing today. It is the midbrain. It's the lower part of the brain that's entering into the spinal cord that controls all of that. So diabetics get problems with digestion and bladder problems. So what happens is diabetics, they don't digest food very well. They don't empty their stomachs very well. They get something we call diabetic gastroparesis. And so that gastroparesis prevents their stomachs from emptying. Diabetics may eat breakfast, and you can find breakfast food remnants in their stomach 8 to 12 hours later. That means it just didn't clear out. Diabetics also get problems with their bladder. Their bladder doesn't empty very well. They don't have good control of their bladder. And so what happens is a lot of diabetics will have some sugar in their urine. And if they get an infection in their urine, the bacteria love it because there's sugar there that they can grow on, and then they don't completely empty the bladder, so there's some bacteria that are left in the bladder to reproduce and cause more bacteria to come, and it's really hard to treat bladder infections for diabetics often. So diabetes causes neuropathy, and neuropathy is damage to the nerves. Diabetes is by far the most common cause of neuropathy, causing up to 50% of diabetics to eventually develop neuropathy, especially as their disease progresses. It most often affects the nerves of the legs and feet, our lower extremities. Neuropathy can be very painful, and the world has no good treatment for neuropathy. There are medicines they put you on, there are procedures they do, there are all these different things, but it really doesn't fix the problem. It's mainly symptomatic control. And the world says neuropathy cannot be cured. Once you get it, you've got it for the rest of your life. And they say there are more than 200,000 new cases of neuropathy each year in the United States. So, type 2 diabetics have two types of neuropathy. There is a relatively painless type that is characterized by numbness, tingling, pins and needles sensations in your lower extremities. You all have fallen asleep on an arm and not slept well, and you wake up and it feels like it's a piece of wood. It doesn't feel normal. You can't move it normally. You can't grip things. Well, that is this pins and needles type of neuropathy. There's a second type, which is much more painful. People have burning. They have aching. They say it is excruciating. It is lancinating. It feels like there is a hot poker or a knife sticking through your arm or leg, and that can be much more aggravating. So this is some research that was done at Weimar Institute way back in 1994. They had 21 patients with type 2 diabetes and this painful type of neuropathy. These patients had had symptoms from 6 months to 10 years. And what they did was they put them in the lifestyle program. They put them on a low-fat diet, 10 to 15% fat, and it was a vegan diet, a plant-based diet with no refined foods. They had the patients exercise by walking briskly for at least 30 minutes or 2 miles a day. These patients experienced complete relief of their pain in 17 of the 21 patients in anywhere from 4 to 16 days. Amen. Praise the Lord. That's unheard of in the world. You know, You don't see people in 2 weeks getting rid of neuropathy. You don't see them in a lifetime getting rid of neuropathy. The pain went away. Some patients may still have had a little bit of the numbness, and by the 14th day, their fasting blood sugar was 35% lower. So they had significant improvements in their diabetes. I don't remember the age. It was a diverse group. It wasn't just, it was 21 patients, and I think their age, I can't really answer that. I don't remember well off the top of my head. On average, the patients lost 10 pounds in 16 days. By the 14th day, their fasting blood sugar was 35% lower. 5 of the patients not only had their neuropathy cured, but they also cured their diabetes. In fact, in looking over some of the websites this week, the world says that treatment can help, but neuropathy cannot be cured. That's what they say, okay? It's God's plan. That's why it can make a difference. Their cholesterol and triglycerides also improved, as did their blood pressure. In fact, in about half the patients, their blood pressure normalized. Again, things that are unheard of with the world's treatment. So, diabetes. What causes diabetes? People say genetics. My parents had it, so I will get it. That's how they feel, right? Well, I think that heredity loads the gun, but our environment is what pulls the trigger, okay? I had a brother-in-law who was a police officer in Southern California. He was a police officer for 24 years. He walked around on duty with a loaded gun on his side, and not once did he have to pull the trigger in the line of duty. And it is a blessing. And he even worked gang detail for a while. Still didn't have to pull the trigger in the line of duty. Just because you have a loaded gun doesn't mean that you have to pull the trigger. Just because you have a family history of diabetes does not mean that you have to become a diabetic yourself. And then epigenetics is the study of how lifestyle turns on and off different genes that may make us more or less susceptible to diseases like diabetes. So, sugar, that's what people say, People will call it sugar diabetes. I have sugar diabetes. Well, yeah, you have diabetes that makes your blood sugars go up, but that's not the real problem. They did a study at the University of Kentucky, Dr. James Anderson. He took a group of lean, healthy young men. The translation is he took a group of medical students. Because, you can get medical students to do research because they want to get their names on papers. They want to get published. It helps them to get into residency so they can go and do the type of work they want to do. So, took a group of lean, healthy young men, medical students, and he put them on a high-fat diet. They got to eat all the stuff they love. Ice cream, cake, candy, sweets, high fat, all that stuff. And what they found is these previously healthy, not overweight young men, their blood sugars started to go up. Within 2 weeks, they were becoming pre-diabetics. He took a second group of lean, healthy young men, and he put them on a low-fat diet. 10 to 15% fat. And he gave each one of them 1 pound of sugar a day to eat. A day. A 5-pound bag of sugar? They split that between 5 guys and said, have at it. And they did that for 11 weeks. And not one of them became a pre-diabetic. So what I just told you, we'll put it in words. Study at the University of Kentucky. Lean men into pre-diabetics in 2 weeks with a high-fat diet. No diabetics with a low-fat diet and 1 pound of sugar per day. It's not the sugar, it's the fat. Fat on the body and fat in the diet that makes us diabetic. So, what do we need to do to start combating diabetes? We need to decrease fat on the body and in the diet. Animal products are the largest source of fat in the diet and the only source of cholesterol. Therefore, you want to start cutting out animal products. The world says cut out the sugar and take this chemical in place of sugar. They also say eat lots of little meals. Well, diabesity is the connection between diabetes and obesity. Food for thought. This is a real billboard. Somebody sent me this picture, okay? If you eat at the dollar menu on McDonald's every day, straight ahead is diabetes. Did you see Super Size Me, the documentary? The guy was trying to eat at McDonald's every day for 30 days and he didn't make it. It was almost killing him. Yeah. Every day, 150 diabetics have their legs amputated. Millions more have nothing to look forward to but amputation, dialysis, neuropathy, pneumonia, blindness, impotence, retinopathy, heart attacks, strokes, all that good stuff. So type 1, what causes type 1 diabetes? Well, these patients, something has damaged the beta cells in their pancreas, and they are no longer producing insulin. If you don't have insulin, it's hard to get sugar into cells. And if you don't have sugar in cells, the cells are not getting energy. So what happens is the body starts to burn other things. And you start burning fat, and you build up these toxins that we call ketones. Diabetic ketoacidosis, DKA, is a life-threatening illness that can actually kill patients. And so this is something serious, and this is something that we want to avoid. Cow's milk protein, the A1 protein in cow's milk, there's a direct link between cow's milk and type 1 diabetes in children. So, why do we tell mothers to breastfeed their children? Why do we tell them to do that? Best for the child. Why else? Increases their immunity. How does it increase their immunity? Yeah, that's right. So there's two types of immunity. There is active immunity and there is passive immunity. All right? The child's active immunity when they are born is not very good. For about 3 months, their immune system is not very strong. And so what happens is if you're breastfeeding that child, you pass some passive immunity to the child through the mother's milk. And it's done through things like white blood cells and antibodies. The same thing is true for cows. For the first few months, their calf is not very immune strong. Their immunity is not very good. And so they pass on white blood cells and antibodies to the calf to help boost its immunity. All right? And so if I injured my arm and I had a cut and it was infected, and you could tell it was infected by looking at it, what would you see? Yeah, you'd see pus, you'd see redness. What exactly is pus? Pus is white blood cells, maybe some antibodies, dead skin cells, all that stuff. Okay? So if we said that cow's milk has white blood cells and antibodies, all right? And we said that white blood cells and antibodies are found in pus, we could make the extrapolation that cow's milk is liquid pus. Yeah, that's exactly the reaction I want you to have. I want you to say, ew, that's gross, because I don't want you to go back to drinking cow's milk. Okay? So, the immune system, both the active and passive immunity, is the body's police force. Antibodies, which are made from white blood cells, seek out everything foreign to destroy it. Our immune system protects us. If it finds something that is dangerous, it creates a reaction. And so what happens is these white blood cells and antibodies that are in the cow's milk, our immune system recognizes they're not human. So it mounts a reaction to them. And in so doing, it actually can damage the beta cells in the pancreas, because to the immune system, those beta cells look very similar to cow's milk antibodies and cow's milk white blood cells. That's how there's a connection between type 1 diabetes in children and the use of cow's milk. So cow's milk, who needs it? Its purpose is to feed a baby cow and make it into a big cow. And I don't want any of you to be big cows. So I don't want you to drink cow's milk. Does that make sense? All right, good. Osteoporosis is porous, brittle bone. The United States is the second leading consumer of dairy products in the world, and they have the second highest occurrence of osteoporosis. Finland leads in both categories. So Finland drinks more milk than we do in the U.S., and they have more osteoporosis than we do. Milk may also contribute to type 1 diabetes and multiple sclerosis. Casein, the main protein in dairy, may contribute to the growth and proliferation of cancerous cells. The American Academy of Pediatrics recommends that cow's milk not be given to infants under 1 year of age. Allergies and asthma have reached epidemic proportions. Infants not exposed to cow's milk develop far fewer allergies. And despite antibiotics, infants fed cow's milk are 70% more likely to develop diarrhea and ear infections compared to breastfed babies. Okay? You know, the onset of diabetes usually is gradual. It doesn't just suddenly turn into somebody who has a blood sugar that's really high and they're out of control. The onset of diabetes takes time. It often starts with something we call pre- or borderline diabetes. They say that prediabetes affects up to 1 in 3 Americans, but only 1 in 10 realize it. That means a lot of people who are becoming diabetic don't even realize it. The way we treat diabetes has done nothing to reduce the burden of disease. And research shows non-drug treatments like lifestyle are much better at controlling the disease and also preventing it. That's why we share with you lifestyle change. Lifestyle avoids also the side effects of medications. So type 2 diabetes, what really actually causes type 2 diabetes? Okay, so just imagine that behind me, this wall is a cell membrane. And imagine right here in the front of the room, there is a blood vessel. Okay, imagine that I am Mr. Insulin. I have 2 arms. I'm produced in the pancreas. My job is to be here in the blood looking for glucose. And when I find a glucose molecule, I grab it with one of my arms and I go up to the cell and I find either a window or a door. I open that insulin receptor, I put the glucose inside the cell and close the door. That's a simple analogy of how insulin works. Okay? Insulin is in the blood, it finds blood sugar, it finds glucose. It then takes the glucose and takes it up to the cell and helps to get it inside the cell. Everybody with me so far? Okay. So think of this room as a cell. Every window and door is an opening, an insulin receptor. The pancreas produces insulin. Insulin has 2 arms. One grabs sugar in the blood, the other opens the door on the cell. It inserts the sugar and closes the door. That is a simple analogy. That's not exactly how it works, but you kind of get the idea. Okay? If we're on a high-fat diet, fat will go up to the cell and seal off the door. So if there's a receptor right here, fat will come along and block it, seal it off. Okay? Then what happens is insulin finds some sugar in the blood, and it goes up to the cell, but it can't find the door. It can't find the receptor because fat has blocked it. It's ready to do its job, but it is unable to do it because it is not able to get into the cell. So insulin comes up with the sugar. It can't open it because fat has sealed the door. And then the sugar starts to build up in the blood. And the body tries to get rid of the extra sugar. Your body is almost as good a chemistry lab as any small hospital, okay? So your body recognizes that your blood sugar is out of whack. And the first thing that your body does is, oh, there's a problem with the blood sugar, and it sends a signal to the brain to say, drink more water, because the water helps to dilute the blood sugar. Now, after you start drinking more water, what's the next thing that happens? Yeah, you got to go to the bathroom and urinate, right? So the body says, hey, we're going to the bathroom more. Let's put a little of that extra sugar into the urine to get rid of it. But at a cellular level, the cells are not getting sugar. They're not getting energy. So the cells are like sending a message to the brain saying, hey, we are starving down here. We're not able to do our work. Eat more food. So do you see how the three classic hallmark warning signs of diabetes, polydipsia, excessive thirst, polyuria, increased urination, and polyphagia, increased appetite, are all related to the blood sugar being up and the body trying to get rid of it? It's all pretty simple if you just understand how it works. Okay, hang on one second. I'm going to change this here. So Dr. Gerald Raven from Stanford University found that high blood insulin levels caused by insulin resistance affected all the cells in the body. We now call it metabolic syndrome. Insulin resistance makes diabetics more prone to high cholesterol, hypertension, coronary artery disease, and being overweight. Hypertension, along with being overweight, high blood cholesterol, high triglycerides, and diabetes are all related to too much circulating insulin. What that means is they then have a high insulin level in their blood. Researchers have linked this to a gene which also appears to make people more prone, more susceptible to diabetes, heart disease, cancer, and obesity around the trunk. They found that patients with hypertension had increased insulin secretion by the pancreas and decreased insulin sensitivity from the cells of the body. These patients are then said to have insulin resistance syndrome. A patient has an inability to respond to normal insulin levels and the need to produce far too much insulin in order to keep your blood sugar normal. So again, insulin resistance means we have higher levels of circulating insulin. More than 50% of the patients with diabetes and hypertension also have insulin resistance. When several mechanisms within our body malfunction, this leads to insulin resistance. Most of the body's cells have thousands of tiny surface receptors for insulin. Insulin attaches to glucose in the bloodstream and it is taken into the cell along with the glucose. The glucose is then converted into an energy storage molecule, what we call ATP, adenosine triphosphate. That is the energy currency of the cell. The glucose, 1/3 of it is oxidized into ATP for energy, and the remaining 2/3 is converted into glycogen, which is the storage form of sugar. So when we take in sugar, Our body makes a third of it available right away, and it stores 2/3 for when it needs it later. Diabetics, hypertensives, coronary, and overweight patients have a defect in this glycogen synthesis pathway. As people get older, the defect becomes more severe. A process within the liver and muscle cells is felt to be responsible. Sodium inside muscle cells is thought to be the fundamental abnormality. It leads to heightened reactivity of muscle cells to stress, which contributes to hypertension. And this same metabolic abnormality is present in all diabetic, hypertensive, and coronary artery or heart disease patients. Metabolic syndrome affects all the tissues in the body. It is also associated with polycystic ovarian syndrome and infertility. Metabolic syndrome is also associated with breast, colon, ovarian, and prostate cancers. So metabolic syndrome is the underlying precursor for all of the lifestyle diseases that we see. It is even associated with Alzheimer's disease. They find that insulin resistance in the brain plays a role in Alzheimer's. So all the different lifestyle diseases come down to this one common pathway, which is metabolic syndrome or insulin resistance. A major cause for metabolic syndrome is too much energy coming in, eating too many calories while not enough energy is going out, not exercising enough. When we are active and we get regular exercise, our cells easily and efficiently use insulin to get energy. A little insulin goes a long way. When we are sedentary, our cells don't need as much energy, and insulin resistance naturally develops. It's a lot easier to start getting insulin resistance. Low magnesium, low potassium, high sodium, high iron, and low intake of antioxidants, all of which are common in the Western diet, are associated with insulin resistance. So if we eat the standard American diet, it's just setting us up for insulin resistance, which sets us up for diabetes, high blood pressure, high cholesterol, cancer, Alzheimer's, all of those things. Beginning at age 20 and increasing with each decade, our risk of metabolic syndrome goes up. There tends to be family predispositions to insulin resistance, to hypertension, to diabetes, to all of these things. Most people who are obese, obesity being 30 or more pounds overweight or 20% above your ideal body weight, have some degree of insulin resistance. Overeating is another thing that can contribute to metabolic syndrome. When we eat too much food, we tend to have stressors, oxidative stress on our bodies, but we also tend to have more insulin produced. If we have physical inactivity, if we're not getting regular exercise, exercise helps to increase the utilization of sugar by cells, and it tends to increase insulin receptors on the surface of cells. So when you exercise, you actually start up-regulating more doorways on your cell. So the insulin your body already is making is able to work better. Within 7 hours of exercising, you will upregulate more insulin receptors. So if you exercise first thing in the morning, by the afternoon, you're going to have better insulin function. Your insulin resistance is going to decrease. Reduced blood flow to large muscle groups. When you get little exercise, you're not getting good blood flow. Your muscles are not needing more energy, so they're not going to start producing more insulin receptors. And when we eat between meals, it causes us to have increased periods of elevated insulin. And so snacking and eating between meals, or eating 6 meals as the world tries to tell you, does not really help with insulin resistance. So aging, as we get older and get a wider waist, we tend to have a greater risk of metabolic syndrome. So men, if your waist circumference is greater than 40 inches, or women, if your waist circumference is greater than 35 inches, you're at increased risk for metabolic syndrome. If your triglycerides are elevated, if they're above 150, then you're at increased risk for metabolic syndrome. If your HDL cholesterol, is that your good or bad cholesterol? It's your good cholesterol, that's right. If your good cholesterol is low, men if it's less than 40, women if it's less than 50, then you're at increased risk for metabolic syndrome. If your blood pressure is elevated, if your blood pressure is above 130/85, you're at increased risk for metabolic syndrome. And if your fasting blood sugar is elevated, if it's above 110, you're at increased risk for metabolic syndrome. So how can we keep our blood sugar down without getting rapid spikes or wide swings from low to high and all of those things? Well, what we find is you need to have a little bit of healthy, natural fat in your diet. And what I recommend is you put the fats at the end of your meal. So the way to do that is to eat a handful of nuts at the end of your meal. Gives you some healthy fat, and it helps to keep your blood sugar more level. It also helps to prevent you from getting hungry between meals. So put some healthy fats at the end of your meal to prevent a rapid drop in blood sugar. Eating more natural, fiber-rich foods tends to stabilize blood sugar levels. High fiber foods also smooth out blood sugar fluctuations and stabilize the energy. The earlier diabetes is detected, the more likely that lifestyle modification will be helpful. The world says, take a lot of little meals, and you don't have to pay any attention to the way in which you eat. Then it says, take these medications because they will help. If the medications aren't helping, we'll move you to stronger ones. Keep in mind that medications are not benign. All of these things have side effects. Here's some research that was done in Prague, Czech Republic, to study the effect of 6 meals a day versus 2 meals a day, eating breakfast and lunch. Both regimens had the same macronutrient and energy content. So what they did was they followed these subjects for 12 weeks, and they took the same amount of calories and split them into 2 meals or 6 meals. They found that eating 2 meals per day, only breakfast and lunch, reduced body weight. So people lost weight on 2 meals a day. It also reduced HFC, which stands for hepatic fat content. So if you have a fatty liver, being on 2 meals a day decreases your fatty liver and starts to get the process healing. 2 meals a day also decreased fasting blood sugar levels. All right? It also reduced C-peptide and glucagon. C-peptide is a hormone that is cleaved when your body secretes insulin. So if you have a lower level of C-peptide, that means you're having a lower production of insulin. That means your body is producing a more appropriate amount of insulin when you take something in that needs insulin. And then glucagon is a hormone that is released when our blood sugar is low. So if you have a lower level of glucagon, it means you're having less low blood sugars and your body is responding more appropriately. And then 2 meals a day increased OGIS. OGIS is oral glucose insulin sensitivity. What that means is when you take in sugar by mouth, your body produces a more appropriate amount of insulin, and it doesn't give you too much to cause these issues with too much circulating insulin. So 2 meals a day, not only for diabetics, but also for healthy people is better. And 2 meals a day is biblical. The children of Israel, when they left Egypt, God fed them heavenly food. We call it manna. The Bible records that they ate it twice a day. Biblical scholars believe they ate it about the 3rd hour of the day, which would have been about 9 o'clock, and about the 9th hour of the day, which would have been about 3 o'clock. When Elijah fled from Jezebel and God led him to the brook Cherith, the Bible records that ravens were sent from God to feed him. And those ravens fed him twice a day, once in the morning and once in the evening. So it's biblical to eat 2 meals a day. So here is a kernel of wheat. And you have these two outside layers. The bran is the very outside layer, and it's rich in fiber, vitamins, and minerals. The germ is the next inside layer, and it also has fiber, vitamins, and minerals. The very innermost layer is what we call the endosperm, and it mainly is composed of starch, which when taken into our bodies turns into sugar. Okay? So the two outer layers have 24 known vitamins and minerals. But we strip those outer layers off, and then we sell them to you as bran, and wheat germ. And we serve you the innermost layer, which is mainly starch that converts to sugar. But we feel bad that we've taken away 24 known vitamins and minerals. So what we do is we enrich the wheat, enrich the flour. Okay? We take away 24 and we give you 4 back. Thiamine, riboflavin, niacin, and iron. That's a pretty good deal, right? Take away 24 and give you 4, and then we'll still sell you the bran and the germ that you can sprinkle it on your cereal. So the fiber that's wrapped around that kernel of wheat serves the purpose of slowing down the process of turning the starch to sugar. And when you strip off that fiber, it actually causes the process to speed up. So grain has 3 parts. The bran and germ is where the fiber is. The fiber wraps around the starch and controls the rate of conversion to sugar. Plant-based diets protect against getting diabetes in the first place, but they also treat the disease better than the diabetic diets that patients are typically placed on. A plant-based diet beat out the conventional American Diabetes Association ADA diet in a head-to-head randomized controlled clinical trial without restricting portions and with no calorie or carb counting. That is because a whole food plant-based diet has low caloric and density. So you're eating foods that make you feel full but don't give you a ton of calories. It was also found to improve quality of life and mood. Patients consuming a whole food plant-based diet also felt less restricted than those consuming the conventional diet. Disinhibition decreased with a plant-based diet, meaning those subjects were less likely to binge eat and tended to feel less hungry. That improves the sustainability of sticking to the plan, of sticking with the diet. And along with improvements in mood came improvements in mental health as well. So when we don't have fiber, as in eating processed foods, the starch quickly converts to sugar in the blood. Blood sugar then immediately goes up like a rocket. And what happens is the body secretes insulin to try to bring that blood sugar back down. The sugar tends to come crashing down, and we get what we call a sugar crash. Diabetics have to eat multiple small meals trying to keep their blood sugar up to give the medicine something to work on. Because the medicine, the half-life of the medicine, is longer than what it takes to digest a meal. So, for example, it may take you 4 hours to digest a meal, but the half-life of the diabetes medicine may be 8 hours, 10, 12. So the medicine is still working even after you're done digesting. So that's why they tell you, well, you should eat a meal, and then you should have a snack, and then you should eat another meal and have another snack. You're basically feeding the medication. And that doesn't make sense. If you eat whole grain items, on the other hand, it gives fuel that goes up and levels off and continues for a period of time. Fiber wrapped around the starch controls the rate of conversion to sugar. So having those natural fibers there slows down the sugar conversion process. It provides a more constant source of fuel. Whole grain items give better glycemic control. So when we're eating whole grain items, we tend to do better. And we want to stay away from juice because juice is fruit and vegetables without the fiber. Even if you put it in like a Vitamix and grind it all up in there, you're still breaking up the fiber, so it's not able to give you that same effect of slowing down the conversion of sugar. So I'd rather see you eat the food than drink it. Let's talk about calories. How much calories are too much? These foods have the same amount of calories, but not the same volume. 3 pounds of apples has the same amount of calories as 4 ounces of chocolate. Which one's going to fill you up more? You know, a 4-ounce piece of chocolate is a small piece of chocolate. It doesn't really give you that satisfaction. 5 baked potatoes has about the same amount of calories as 5 ounces of steak. I don't care if they're even small baked potatoes. 5 baked potatoes is a good amount. 5 ears of corn has about the same amount of calories as a 10-ounce milkshake. You know, we don't think of a milkshake as food. We just think of it as the drink that goes with the food. Right? It's not food. And this one's my favorite. 25 medium carrots has about the same amount of calories as 1 small brownie. Once you've gotten 1 small brownie, you want another one because it's a small brownie. You feel like you were gypped. You were cheated, right? And I don't care if it's 25 baby carrots. Try eating 25 carrots in one sitting. Even baby carrots. It's a lot. It'll fill you up. So to treat diabetes, what do we need to do? The very first thing, the most important thing, is walk for 1 hour a day. 1 hour a day of walking is equivalent to 5 units of regular insulin for a diabetic. Walking 1 hour a day. That's the first step. Check your glucose first thing in the morning, right when you wake up. If your sugar is low, you may need to take a piece of fruit with you in case it drops, especially as you're in that transition between being diabetic and starting to reverse that diabetes. I also recommend that you cut out refined items, white bread, white pasta, white rice. All of these refined items are going to make your blood sugars go up. As a diabetic, the next thing you need to do is you need to make weight loss a habit. You need to watch your portions. Get adequate sunshine. Keeping your vitamin D levels up actually helps to lower your risk of diabetes. Here's another major one. Get 8 hours of sleep per night. Sleep is crucial for health, but especially for diabetes health. Drink adequate water. It helps to dilute your sugar. Which one is sweeter, a grape or a raisin? A raisin. And what is a raisin? A dehydrated grape. So if a dehydrated grape is sweeter than a hydrated grape, you don't want to be a dehydrated diabetic because then you're going to be sweeter. Your blood sugars are going to be higher. So remember, be a grape, not a raisin. Okay? You don't want to be all shriveled up, right? And then get on a regular schedule. Our bodies do better when we are on a regular schedule. So our bodies like order, like regularity. Okay? And for your consideration, meat on this side and beans on that side. So the meat, 20% of the calories come from protein. The beans, 25% of the calories come from protein. So don't forget that plant-based foods have protein in them. The meat, 80% of the calories come from fat, which is mostly saturated, which is not good for you. The beans, 5% of the calories come from fat, and it is unsaturated, so it's a healthy fat. The meat has no complex carbohydrates. The beans have 70% of their calories from complex carbohydrates. The meat contains excess hormones. The beans help you to discharge excess hormones. The meat raises your cholesterol. The beans lowers cholesterol. The meat has no fiber. The beans are high in fiber. The meat may contain steroids and antibiotics. The beans, if organic, have no chemicals. The meat tends to constipate you, to back you up. The beans helps to keep you regular. The meat is unsustainably produced. The beans are sustainably grown. The meat depletes the earth. The beans adds needed nitrogen to the soil. The meat costs $5 to $10 per pound for one serving. The beans are $2 to $4 per pound, and typically you can get 4 servings out of that. Okay, old numbers. All right. Questions, comments, concerns? And while we're asking questions, for those of you who didn't get it or need it, there is our information for NEWSTART.